Hello, and welcome to the COVID-19 Vaccines, an all-female conversation webinar. My name is Deja Gant, and I am student intern in the Louisiana Department of Health's Office of Community Partnerships and Health Equity. This webinar is being done in collaboration with LDH's Office of Community Partnerships and Health Equity, the Governor's Health Equity Task Force, and the Baton Rouge and La Capitale chapters of the Links Incorporated. Further, the Office of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana, in particular vulnerable communities and populations' awareness and readiness of COVID-19 information regarding the virus and vaccinations. This devotion spurred the creation of the Office's COVID-19 Vaccines Conversation Series. Today's event is the 8th webinar in this series. At this time, Dr. Courtney Phillips, the Louisiana Department of Health Secretary of Health, will share a few words.
Thank you, Deja. And good evening, wonderful ladies. I'm excited for having all of you join this wonderful, phenomenal female conversation. This conversation is so important because as women, we often take care of everyone else and we put ourselves to the side. And today is the day that we have a conversation of why COVID vaccinations are important for us. It's important for us to be the representatives in our family, for us to speak up. It's time for us to share our experiences with our family and express the importance of why they should get vaccinated. We have a phenomenal panel. I'm excited for these ladies to share their experiences with you, as well as the importance around it. And so I just want to thank the Baton Rouge and La Capitale chapter of the Links Incorporated, as well as the Governor's Health Equity Task Force, and of course, the wonderful LDH team members who have been putting these on across the state. And so again, I think tonight you are in for a phenomenal treat. We have a wonderful panel who's really going to talk to you and have some just deep, candid conversation. And these conversations are extremely important because we're about 30% of our Louisiana residents that have been vaccinated. Over 56% of those have been women, but we still have a long ways to go. We do know that we see an increase in the COVID variants across our state and across the nation. So this really is a race against the variants. We know that the variants are more transmissible. And so again, the more and more that we can do to protect ourselves, our families, and our loved ones, we will be better off in our state because of it. So thank you again for the opportunity to share this information with you. And I'm excited for the panel you are about to hear. Thank you all.
Thank you, Secretary Phillips. Now, the Deputy Director of the Office of Community Partnerships and Health Equity, Mrs. Devondra Brown, will speak.
Thank you, Deja, and thank you for joining our COVID-19 Vaccines and all-female conversation. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find the information here today useful and applicable to yourself and your families. So without further ado, I'd like to introduce our esteemed moderator, Dr. Robin Merrick. Dr. Merrick is the Vice President for External Affairs at the Southern University A&M College in Baton Rouge, Louisiana. She has previously provided leadership for the university's 90,000 alumni, serving as Director of Alumni Affairs and Executive Director of the Southern University Alumni Federation. Also at Southern, Robin co-hosted the university's radio show, Inside the Southern University System, and is the former co-managing editor of the Southern University System magazine. Through her career in higher education, she has held several administrative positions as Executive Associate to the President, Director of Public Affairs, and Policy Development Coordinator. Robin holds a Bachelor of Science degree in Business Administration, a Master's in Public Administration, and a PhD in Public Policy. Dr. Merrick, the floor is yours.
And I'm muted. Thank you so much, Ms. Gant, Secretary Phillips, and Mrs. Brown for starting today's event. For each of you community members and stakeholders who took out time of your very busy schedules to attend this important discussion this evening, we say thank you. In this webinar, our hope is that what you hear, you will find useful, empowering, and encouraging. We want people to leave the conversation ready to protect themselves, their families, and their communities from COVID-19. Thus, in this webinar, we're going to hear information about the facts as it relates to COVID-19, as well as how community members are feeling towards the COVID vaccines. We have trusted gatekeepers from around our state who will lead and be a part of this discussion. But before we get to that, want to just go over the 3 facts that we are going to talk about quite a bit. And they pretty much boil down to information, vaccination, and prevention. Information, we want you to get up to date and accurate information from credible sources related to COVID-19. Vaccination, of course, everyone in Louisiana 12 and older is now eligible to get vaccinated against COVID-19. And then prevention, mask up, social distance, wash your hands, which can protect women and their families from COVID-19. So these facts are ones you will hear throughout our webinar this evening. And right now we're going to start to lay an additional foundation of facts for you. But before we move on, I want to stress the importance of getting information from trustworthy sources. So if you're going to share COVID information with loved ones or within your communities, we ask that you please use only information coming from websites like the Louisiana Department of Health or the CDC, and we will provide you with a one-pager via email after this session this evening to aid you in how to share COVID-19 information effectively. Sharing the right information can help save many lives. So as we now proceed to our panel discussion, for those listening, please note that some community members provided questions for our panel during the registration process for this webinar. And if you have additional questions, we ask that you put them in the Q&A box that's located at the bottom. So I now would like to introduce you to 5 very phenomenal females who will lead tonight's COVID-19 all-female conversation. First up is Bethany Blackson. She's a native of Winsboro, Louisiana. She's a graduate of Louisiana State University, where she obtained her Bachelor of Arts in English and Sociology. She obtained her Juris Doctor from the Southern University Law Center, and she is currently the Interim Director of Legislative and Governmental Affairs for the Louisiana Department of Health. Welcome, Bethany. Next up is Leah Montgomery. She's the First Lady and Chief Administrative Officer of the Greater King David Baptist Church. Leah has a Juris Doctorate of Law and a bachelor's degree in Business Administration and Economics, and more than 3 decades of experience in church administration, outreach, and community service. And a very lucrative, or I should say after a very lucrative 18-year career as a financial advisor and investment banker, and many years of public service in higher education, where she served on the Southern University Board of Supervisors for 12 years, in transportation with the New Orleans Airport Board for 15 years, and economic development with the New Orleans Regional Business Park Board for 10 years. She fully utilizes her foundation of faith, knowledge, and expertise gained in corporate America for the benefit of those in need and underserved communities. Leah is a native New Orleanian, a member of Delta Sigma Theta Sorority Incorporated, and a member of the Baton Rouge chapter of the Links Incorporated. Welcome, Leah. Next, Dr. Rosalind Slaughter. She's board certified in pediatrics. She currently practices solo at the Baton Rouge Pediatrics Clinic, also currently a lifetime member of Jack and Jill of America Incorporated, the Baton Rouge Associate Group since 2014. The commitment to service, children, and human equity continues to be her top priorities. Welcome, Dr. Slaughter. Dr. Yolanda Taylor has joined Associates in Women's Health in June of 2011. She is a native of Greensburg, Louisiana. She received her Bachelor of Science degree in microbiology from Louisiana State University. Dr. Taylor earned her medical degree from Howard University's College of Medicine in Washington, D.C. She completed residency training in OBGYN at Kaiser Permanente in Oakland, California. And Dr. Taylor is board certified by the American Board of Obstetrics and Gynecology. She's a member of the Baton Rouge chapter of the Links Incorporated. Welcome, Dr. Taylor. Linnell Young, our final panelist, is a Louisiana licensed professional counselor, a Louisiana certified parenting educator, and a nationally certified school psychologist with more than 21 years with the East Baton Rouge Parish School System. She has a Bachelor of Arts degree in biopsychology from Vassar College in Poughkeepsie, New York, and a master's in clinical psychology from Louisiana State University. Linnell has directed the Louisiana Parenting Education Network, which provides support and professional development activities for parenting educators throughout Louisiana. She is currently the Vice President of the Governor's Children's Cabinet Advisory Board and a member of the La Capitale chapter of the Links Incorporated, where she serves as Vice President and member of the Health and Human Services facet. Welcome, Linnell, and again, welcome to all of our panelists. These are our phenomenal panelists for this evening. They are going to help us have a brief but deep discussion on matters concerning women and COVID-19. As we start this panel discussion, it is important that we emphasize that COVID-19 is not over. Cannot emphasize that enough. It is not over. We must continue to remain vigilant and protect ourselves and our communities, masking up, physically distancing ourselves, continuing to wash our hands and sanitize our hands when we cannot wash them. And when you're ready, get vaccinated. So let's start the panel discussion. This discussion will be factual, based in science, and it will be addressing the hesitancy that some women may have in regard to COVID-19. But let me be the very first to say that as moderator of this session, that people have a right to feel what they feel regarding their past and present experiences of racism, sexism, mistreatment, or injustice. We know these experiences are real and they play a part in people, populations, and communities' vaccine hesitancy, and we respect that. So my first question to each of our panelists is, this may seem like a question that we would probably save to the end, and we just might again, but we want to hear from each of you about what it is that you want women listening to this webinar to take away from this evening. And we will start with you, Dr. Taylor.
Good evening, everyone. Thank you for having me. I want every woman on this webinar to take away great information that is accurate and factual, because we are able as women to disseminate all of this information, and we want every woman to be armed with the facts so that we can get our friends and our families vaccinated. We have not herd immunity and we need to, but this is how it starts.
Thank you, Dr. Taylor. I'm deliberately asking our physicians first. So Dr. Slaughter, you're next.
I am so glad to participate in this panel because I am passionate about returning to some kind of normal. Parents are concerned, and of course, women run the household in terms of health in their households. Let it be known that more women are vaccinated in Louisiana than men. And of course, when it comes to making decisions about children, the women make the decisions for the most part. I want you to have correct information. I don't want you to be afraid, but we do respect your right to have different opinions, but know that we are going to continue to talk to you every time you hit our door and every time we see you on the street.
I love it. Every time you hit our door and we see you on the street. Thank you, Dr. Slaughter. Next, we'll hear from Linnell Young. Linnell, your response to the takeaway question.
Thank you, Dr. Merrick. As you mentioned, I would like the participants this evening, for the ladies to feel empowered to make good decisions for themselves and for their families. I'm so excited that we're bringing mental health into this conversation, because I hope after this discussion tonight, everyone will understand the importance of protecting our mental health, and that being vaccinated is the first step that provides hope for a brighter future.
Thank you, Linnell. Leah, what is your takeaway? What is your desire for the takeaway?
Thank you, Dr. Merrick. And I'm also very happy to be here and to be a part of this panel discussion. I would like the ladies to take away two things. One, we know that we are the nurturers, but we're also influencers. All of us are. the panelists and the participants. So let's continue to talk about this. Let's have these conversations, continue to share our personal whys. It could help someone make a life-saving decision for themselves and for their family. So we need to continue to talk about why we got vaccinated, why we're not getting vaccinated, so that we can get the information we need to make the informed decision.
Okay, and thank you for that, Leah. Miss Bethany Blackson, it's really by design that you are last because you are our youngest member of the panel. No age discrimination or reverse age discrimination here. But curious to know from your standpoint as a young person, what's your takeaway hope for this discussion this evening?
Yes, thank you, Dr. Merrick. My takeaway would be for women to be informed and spread the word. You know, we all have different platforms. We all have different, you know, messages and ways that we can spread the message of vaccination via social media or other, you know, other networks of communication. Working with the Department of Health, I know that's one of our key messages right now with our vaccine campaign is spreading the word to make sure that all citizens are informed. So that would be my main takeaway. Our hope for persons on the call today would be spread the word. You're getting factual information tonight, and, you know, make sure that your families, our friends, my girlfriends, like our, you know, friend groups, that everyone is informed and that you can make that decision upon yourself, whether to get vaccinated now, later, but at least you're getting that information. So that would be my takeaway.
Thank you. So just to recap, we heard get the facts. We're going to hit you up on the street and every time you hit our door. Empowering, protecting mental health, influencers and influencing. Just talk about it, be informed, spread the word. Those are just some of the takeaways I took from your answers to that very first question. So we'll get into the science. We'll start with the science this evening, and I want to have a quick exchange between our two physicians first, and then we'll move to the other members of our panel. And so Dr. Taylor and Dr. Slaughter, I'll bounce back between the two of you with these questions because these are some of the questions that, you know, there's a lot of misinformation circulating, and I think you all can help, as they say, bust the myths on this and provide the correct information. So Dr. Taylor, is it safe for people who are pregnant or breastfeeding to get a COVID-19 vaccine? And you may be muted.
I'm sorry.
There you go.
Our professional organizations believe that it is very safe. So our professional organizations, they include the American College of OBGYN and the high-risk OB docs. They belong to the Society of Maternal Fetal Medicine. So we all know, well, most people know that, unfortunately, pregnant women were not included in the trials for the vaccine. And let it be known that we were requesting for pregnant women to be included in these trials. That did not happen, but that's okay. But the research is ongoing, and we know the makeup and the function of the vaccine, which is why we think that it is so safe. It doesn't get into the DNA, and it is not a live vaccine. It clears our bodies in a very short time, and our bodies just make the antibodies. So there are great things about this vaccine that are safe for pregnant and breastfeeding mothers. The issue is if a pregnant woman, this is why it's so important, if a pregnant woman becomes infected with the virus, she is at a higher risk of having more severe illness, of getting admitted to the ICU, of having to have ventilatory support, and of dying. And unfortunately, at Women's Hospital, we recently had a pregnant woman to die. And so we really are encouraging women, pregnant women especially, to consider getting the vaccine. And Dr. Merrick, thank you for saying that it is not we're not holding the bat over someone's head, but we are definitely encouraging our pregnant women to get it. And there are, as I said, the research is ongoing. There are lots of studies out there, but there is something that the CDC put out. It's called the Be Safe Pregnancy Registry for pregnant women, and they are following these people very closely, but they are not demonstrating any safety signals. So there is nothing untoward that we can see now. And of course, during the trials, there were some women that got vaccinated and did not know they were pregnant, but they were pregnant. And so they're following those women closely too. And there have not been any untoward outcomes, no bad pregnancy outcomes from those women. So we think it's very safe, and we're encouraging our patients to get it.
Gotcha. And I just want to clarify, Dr. Taylor, the unfortunate passing of the pregnant woman at Women's Hospital, she passed from COVID and probably had not had the vaccine, we believe.
That's exactly right.
Just wanted to clarify that. Okay, so going to Dr. Slaughter, and we'll be talking about it on both sides, but again, wanting to honor our two medical professionals that are with us this evening. Is it safe for children over 12 to get the vaccine? So 12 and over, since now the number is at 12.
It is very safe for pediatric patients 12 to 18 to receive the vaccine. With the original trials, those studies were done in 18 and older. As soon as that was approved, trials began in patients 16 to 18. And those were tens of thousands of pediatric patients in that age group. After that, and also the 12 to 18-year-olds. Now, people are more prone, it seems to be, to get the vaccine for the 12 to 18-year-olds. Because I think they want them to go back to school, they want them to get back to normal sports and activities. When you're 16 to 18 as a teenager, you have more to say about what happens. I don't want that vaccine. Social media comes in. I heard this, I heard that. But studies have been done. There have been side effects that pretty much are the same as the adult population. And the AAP, American Academy of Pediatrics, the state Department of Health and Human Resources, and many other organizations, pediatric organizations, are fully behind vaccinating the pediatric age group. So yes, the vaccines are very safe in 12 years and older.
Okay, thank you, Dr. Slaughter. Back to you, Dr. Taylor, and we'll go back and forth, like I said, just for a few minutes. Can a child of a vaccinated mother benefit from antibodies? We know that we're hearing a lot about the antibodies and the length of time that they stay in your body, but can a child of a vaccinated mother benefit?
Yes, and remember, Dr. Slaughter is talking about 12 years old and older. So when a pregnant woman gets vaccinated, those antibodies that she produces are transferred to the baby through the placenta and the cord blood. These babies are born with the antibodies. And so we assume that they're protective because they're not getting vaccinated, but they can get the virus. As we all know, it is not common, but it is possible. So why not add the protective effect to these babies by vaccinating the pregnant mother? So yes.
Got it. Got it. So that's good to note. Dr. Slaughter, you said earlier in your comments of the why of the 12-year-olds and up getting vaccinated, but just talk a bit about the side effects in children. Are they different in children? Are they the same as adults? Or just what are the side effects that we can anticipate in a child 12 to 18 getting this vaccine?
The side effects are very similar in all populations. The most common side effect is pain at the injection site. Most people have mild symptoms after the first vaccine, but with the second dose, we do see more side effects, but it's different for everyone. Some people may have fever, chills, swollen lymph nodes under the arm of that they received the injection of the vaccine.
Okay.
So it is different. There are different side effects, but they are the same. We are not seeing any big differences. I'm trying to think of some of the things the patients have told me that they are afraid of, but the side effects are the same.
Okay. So side effects are the same in children as they have been in adults. And we are still watching everything very closely.
Yes, constantly monitoring, looking for any different kinds of side effects. That is what guides us to look at other things more closely.
Mhm.
Let's be clear, recently they have started looking at myocarditis, which is some inflammation of the heart.
Okay.
Well, that is also seen from any other virus.
Mhm.
So that is not just unique to COVID vaccination.
Okay. That is an important point to note, that it is seen in the actual virus itself. Thank you, Dr. Slaughter. Going back to you, Dr. Taylor, and this is a two-part question. Are people required to take a pregnancy test before they receive a COVID-19 vaccine? And speak to this rumor out there about the COVID-19 vaccine causing infertility. We want you to debunk that rumor, rather.
Okay, so the answer is you do not need a pregnancy test to get the vaccine, period. They're not going to even ask you. And if they do, it doesn't matter whether you are or not. So you don't have to take a pregnancy test. As far as infertility, okay, I'm going to make this very quick because it is important. I actually spoke to one of our infertility specialists recently about this. And there was an article that came out, and they said that the protein that was on the vaccine was similar to the protein that they found that we know is in the placenta. Now, that was actually not true. Now, there are some genetic codes that they share, but they do not have the same immune response. They are not the same. So they published that article, but they had to retract it or redact it 3 days later. But it was out there at that point. So we have been trying to fight this. Not fight. We have tried to debunk this myth since then. As I said, there are women that were pregnant during the trials, and we have not seen any evidence that there is infertility, that women are having trouble getting pregnant because they got the vaccine. We actually are more worried about the opposite thing. If they get sick with the virus and are not vaccinated, then we worry about outcomes that are not so good, right? So miscarriages and possibly stillbirths. That poor woman that passed away at Women's, her baby was premature. And so there are other things that are more concerning because you don't get the vaccine, but infertility is not one. We do not see that. There is no evidence out there that points to that. And the specialist that I spoke to, he actually did a podcast. So if you want to find it, Infertility Answers, he talks about it. He's amazing. And there's a 10-minute podcast. It's on YouTube and all that, but he speaks to that. And he is one of our experts.
Thank you. Thank you for taking the time and even going deeper into that question, because that rumor is still floating out there. Many people are afraid of that. Dr. Slaughter, let's talk a bit about children with disabilities. I don't know that we've heard much about that, but are there any contraindications rather for children with disabilities in taking the vaccine?
There are some individuals that need to speak with their doctors and specialists before they receive the vaccine. because of underlying conditions that may fall within some other categories, such as severe allergies. That does not mean you cannot take the vaccine, but there are other precautions to take. It may mean that you need one vaccine and not the other vaccine, because there are options. In addition, there are some individuals who may have some underlying health conditions that may predispose them to some other issues. So if you have some unusual illness, you have to talk to your physician and or specialist, and that's whether you are an adult or pediatric patient. However, patients with disabilities definitely need the vaccine, because the vaccine will prevent severe disease that may cause other issues. So general disabilities, I know that's kind of lumping everything together. Talk to your primary care doctor and they will help you make the best decision.
Right.
Unusual severe disabilities, underlying conditions, talk to your primary care physician and specialist.
Gotcha. That is a huge takeaway, to be certain that you are in constant communication with your primary care provider, especially if you have those unique situations. Thank you for that also, Dr. Slaughter. Dr. Taylor, we're going to come back to you, and we're going to move off of the obstetric side of what you do and more onto the basic gynecology side, I guess. And that is, will the COVID-19 vaccine alter the results of a mammogram? We've been seeing some talk of that lately. So tell us more about it.
So one of the side effects of the vaccine is lymphadenopathy, or the lymph nodes under the arm, in your arm, the axilla, will become swollen. Now, it's self-limited, it does go away. So if you get a mammogram and you've had a recent COVID vaccine, and they will ask you, have you recently been vaccinated? So that they can know that when they are looking at your mammogram. So we are recommending, and this is the radiology organization as well, that you probably want to consider getting your vaccine and waiting for about 4, some people say up to 6 weeks, and then getting your mammogram, or get your mammogram and then you can immediately, well, as long as your mammogram is normal or negative, then you can get the vaccine. So just know that there may be like a waiting period that you need to adhere to, so that the anxiety will not be there, because remember, it's just a side effect. It will resolve.
Gotcha. But it won't actually alter the results of a mammogram. You may just have something a little
different. And the literature says that they're basically false positives. So yeah, they will read it that way, but you probably will have to get your mammogram repeated to verify that that's indeed what it is. Because breast cancer can also present as lymphadenopathy. So we have to make sure that those two things are fleshed out.
Okay, thank you. And thank you for that awareness regarding the mammograms. Dr. Slaughter, one more question for you. And I think this goes without saying, but we just want to be clear. Does the parent have to consent to the vaccinations for the children 12 to 18?
Yes, consent is needed for all patients 12 years to 18 years old. After 18, the patient can sign for themselves.
Okay.
And I think that the consent form has the birthday, because some people are like, do I need the birth certificate or social security card? You do not. You just have to say, this is the birthday, I'm the parent signing.
I see. Okay, thank you. We're going to move from our two physicians just for a moment. So Dr. Taylor, Dr. Slaughter, take a pause. But we're going to now move over to our counselor, who's our mental health expert here on the panel, and that's Linnell Young. Linnell, my question for you is, now that the two physicians on the panel have talked about the science, we've heard a good deal about it, and we know that shaming and blaming is not an effective strategy. So what approach would you suggest that women take when advocating for vaccine participation?
Well, that's correct. Shaming and blaming are not effective ways to advocate for vaccinations. So we're already in a very difficult situation, and we don't want to make people feel worse. But also, we have to recognize, as someone mentioned earlier, that we each have our own individual experience. Some may be past or current traumatic incidents, and those things will impact how we view and how we react to different things in our lives, like, for instance, the vaccination. So we have to be empathetic. As we've said, we don't want to beat people over the head. We have to be empathetic and acknowledge their feelings and try to help them work through those things. Remember also, when we start these conversations, this may be the very first and perhaps the only opportunity that the women have had to talk about or share their feelings about what's going on now with them or what has happened to them in the past, which is critical that some of these issues are addressed. And perhaps you can't address them all with them and may need to help refer them to get more help, but that's an important start in working with our ladies. So the American Psychological Association, I want to close with this. They recommend 3 steps to protect our mental health. And I've heard many people say, sometimes I feel like I'm getting to the edge, I don't know how much more of this isolation I can take, or I'm so worried about this, I'm anxious about this, I'm worried about the vaccination. But let yourself feel hope. It's okay to envision how things might get better. Also, let yourself take care of yourself. And as women, we tend to nurture everyone else and ourselves last. But it's okay to take the time and nurture yourself. And also, let yourself tap into your social support and connection. Make an effort to do that and to stay connected. We have to protect, as I said, our mental health is just as important as our physical health. It's all connected, and we have to protect that part of our being.
Thank you. Thank you so much, Ms. Young, for that. I'm going to move to Mrs. Montgomery and the faith community. As a respected woman of faith in the community, can you share with us your faith perspective on the COVID-19 vaccine? We've heard a lot of conversation in and around the faith community about vaccine participation. But we'd like to hear, your perspective on that.
Thank you. Well, for the believer or people of faith, we know that faith without works is dead. And of course, that's found in James chapter 2. But basically, our perspective is, while our faith is our foundation and very important, we have to ask ourselves the critical question, what are we doing? What are we doing to address the problem? But Pastor Montgomery states it like this: we have to do the possible. That's what we're responsible for. And God will do the impossible. And for us, in this instance, the possible is wearing the mask, social distancing, washing our hands regularly, and getting vaccinated. And getting vaccinated, from our perspective, is a layer of protection. That could be life-saving, and it's certainly worth the limited known risk, such as the minor soreness and possible headaches and nausea. And someone once said that an ounce of prevention is worth a pound of protection. We know that COVID-19 is real. We have heard of the hundreds of thousands of lives that have been lost due to COVID-19, and many of us know or have lost loved ones. And so just because we have faith in God, that does not make us exempt. It does not make us the exception. And all the more, as believers, we should lead by example. We should take the precautions, and we should do the possible.
I'm going to have to talk to Reverend Montgomery. Yeah, you gave us a little sermon here this evening, Mrs. Montgomery. Thank you for that. Especially reminding us of the old adage about an ounce of prevention. It indeed does go a long way. So I think we've forgotten about some of the old standards, as I'll call them, and some of us on this call are old enough to remember that. So thank you for that. We did get a question in the Q&A section that I did want to go back and ask, present to one of our physicians. So either one of you, if you'd like to take this question, and that's regarding travel, air travel, and your opinion about air travel as it relates to those who have been vaccinated or have not been vaccinated. So Dr. Taylor or Dr. Slaughter or both, if you'd like to respond to that question.
I'll go first, Rosalind. So I will use a personal example. My daughter goes to college in Chicago. We had to take her to school last fall, but the vaccine was not available at that point, but we had to fly there. And I had my N95 on from the time I walked in that airport until the time I left, because I had to. I got vaccinated, and I went to a family wedding 2 weeks ago and we flew to California. I'm fully vaccinated. My husband and our 3 daughters, all vaccinated. I had my mask on, I socially distanced, but I felt much better because I knew I was vaccinated and it was much safer for me to travel. So right now, there is no rule as to whether you need to be vaccinated to travel. Some people think that international travel may look like that, but when you are vaccinated, you still have to do the normal things, wear the mask, socially distance. But if you're vaccinated, you're going to feel way more protection, because as you guys may already know, these airports are filled with people. The airplanes are not leaving any seats empty. And you can get a little bit anxious because of that, but not when you're vaccinated. It's a little bit better.
Okay. And Dr. Slaughter, did you want to respond as well?
I just wanted to add that once you are vaccinated, if you have a 2-dose vaccine, it is important to get 2 doses. A lot of people are getting 1 dose, which gives you a lot of protection, but you still need 2 doses. Even if you do the Janssen or the Johnson & Johnson vaccine, you still have 4 weeks. So what I'm finding is people getting the vaccine and travel. You are not fully protected unless it's within that time frame.
Thank you. And I'll take this moment to remind everyone who's watching that the federal law does still require you to wear your mask in the airport for public transportation and on the planes as well. So vaccinated or not, you are still required to wear your mask. So I'll make that quick CDC plug while we're talking, especially as we are up on a holiday weekend. So there may be lots of travel as we're trying to reclaim some of our sense of normalcy from previous years. Let's switch a bit now to Mrs. Montgomery. We're going to come back to you. And Bethany, I haven't forgotten you. I'm saving you for last again. What role has your congregation, Mrs. Montgomery, played in vaccine distribution? And why do you all see that as important?
Well, I have to say that Pastor Montgomery and our healthcare ministry leaders, that's Dr. Stephen and Mrs. Danielle Kelly, embrace the criticalness of this outreach with a personal mission for our church in particular, to facilitate, to educate, to counsel all of our congregants and the community at large, whosoever will. Further, we counseled many with various concerns. Some were spiritual, some were dispelling rumors and myths by simply sharing the facts, the information that reliable information that we had available to us as things progressed. And we also shared our personal whys as to why we chose to be vaccinated and why we recommended that every eligible person be vaccinated. And I will say the most effective method we used to simplify the choice was to draw a parallelism between COVID and diseases that are more commonplace and familiar with us, but just as deadly if undiagnosed or undetected, such as high blood pressure and diabetes. Now, high blood pressure and diabetes are arguably ongoing pandemics in their own staggering statistics. Unlike COVID, the treatment for high blood pressure and diabetes begins with detection or diagnosis. But with COVID-19, we have an opportunity to get in front of the dreadful disease with prevention or preventive vaccine. So we encouraged everyone from that perspective to please seize the opportunity to be vaccinated.
Yeah, so this has really become an extension of ministry in many ways for your congregation.
Yes.
Fantastic. Thank you, Mrs. Montgomery. Miss Bethany, like I said, we were saving our youngest member for last. Did have a question for you. The first is, what factors went into your decision to get vaccinated? And you may be muted, Bethany.
Sorry, I was talking and then I realized I was still on mute. I was saying, I guess one of the factors that I would say for me, working for the Department of Health and getting factual information about the vaccines, about COVID, and kind of, you know, being working on the grounds with our agency. I felt comfortable getting it because I too wanted to get back to a form of normalcy. I'm from a very large family. My mother is the baby of 12. So last year, not being able to, you know, see my family, see my mom, see my aunts and uncles, that was really tough for me. So knowing that getting the vaccine, I wanted to protect them because I have a lot of older relatives that I'm not trying to expose to, you know, the virus or anything. So my sister and I, we stayed at our house in Baton Rouge. We didn't go back home to North Louisiana. You know, often we would see our parents from a distance if we, you know, met them halfway somewhere. So getting the vaccine really allowed me to feel more comfortable being around family members that I love, being around my friends. So still, you know, like you said, practicing social distancing now and being cautious and cognizant of, you know, where I'm going and just, you know, making sure that I'm in a safe atmosphere. But that was really one of the main decision points for me in getting the vaccine. Even after, I mean, I did experience COVID. I had COVID last year, but that did not prevent me from wanting to still get the vaccine. And if anything, it made me realize, you know, my symptoms, you know, maybe if I had the vaccine, my symptoms may not have been as bad, you know. So I just think that this is the only way that we're going to get back to some form of normalcy. And I know that there's hesitancy. I know I have friends that are my age who, you know, they're wanting to have children. They have questions about, you know, the vaccine and if it's going to, you know, hurt fertility issues. So I'm glad I'm on this panel tonight, and I hope that some of them are on as well to hear, you know, these are myths. This is not true. So I'm encouraging my family and friends. That's something that I've been trying to spread throughout this process as well.
Thank you, Bethany, and thank you for sharing with us about your specific COVID experience on last year, because I think we may not have enough sharing going on in general in our society about, you know, what our individual experiences have been and some of the things that led us to the decisions that we're making, especially as it relates to this particular virus, because it is, as we said earlier, it's not done yet, and we have to be indeed mindful of that. Linnell, coming back to you and coming on the heels of what Bethany just shared with us, given her age, and she did say she was talking to some of her peers, what approach do you suggest for those of us who are on the call when we're talking to adolescents and young adults and young professionals, even in terms of encouraging them about the vaccine?
Yes, thank you, Dr. Merrick. We know, as we just listened to Bethany, the importance of engaging young people to have these conversations with their peers and to share their experiences, particularly their positive vaccination experiences. And we also know that people, they have a desire to be independent and exert control over their lives. So we can help them see how becoming vaccinated presents an opportunity for them to have control of their own well-being. They're eager to re-engage with their friends and families and resume activities that they have enjoyed pre-pandemic. So working with them to explore less risky ways to get back to that lifestyle is a good approach to get them to consider better options, better life-saving options like vaccinations. And of course, open communication with young people, that's very important. It's important to have them be a part and feel a part of all the efforts that are happening in their families, in their communities to address vaccine hesitancy and to hear what they have to say about it. And sometimes they may have some of the solutions we have not thought about. So respect their opinion, ask for their thoughts and opinions, and respect that and do that in a respectful manner. And as we know, social media, I mean, it's a two-edged sword. So we should utilize that strategy in a positive way. And text messaging, of course, has been effective. And also looking at existing and maybe new peer support opportunities for young people to get together and share their feelings and maybe some solutions to what their concerns are.
Okay, thank you. Thank you for that. So coming back to you, Bethany, I said I was saving you. So Bethany, as a young professional woman with a family in your future, possibly, can you share the essence of issues that you're discussing with other young women?
Yes, so I hit on one issue. I know, like I said, within my friend group, especially when the vaccines were, just coming out, I'm texting my friends, I'm texting my mom and my, relatives, letting them know, hey, your age group is ready. Like, you all, please go get the vaccine. And then, like my friends, when when it pretty much opened up for, all persons, I'm telling them and encouraging them. So conversations that I've had with them. One, like I stated, it's been around, fertility issues. That's a conversation that some of my friends have had. I do have friends that are in the healthcare profession, and some of them, some are still hesitant, about getting the vaccine. So just having that dialogue with them, I know that they're getting the facts, providing information to them as well. Just like you said, you can't force a person to do anything, and people have their rights and they have their own opinions as far as like why they don't want the vaccine, and that's perfectly fine. For all of us to have our our different views and different opinions on the vaccine at this time, but just having open dialogue and just having that space, that safe space for my friends and for myself included to just kind of have those conversations. I think that's really been helpful in not only spreading the word, but allowing people to feel comfortable at some point in getting the vaccine. So these are the conversations that I'm having, not only with my friends that are my age, but like I said, my parents, my older relatives. It's a conversation that I'm having across the board, especially like I said, working for the Department of Health and having factual information. That's really been helpful in my family members and friends taking the information that I'm providing to them to heart and knowing that it's not just something that I'm getting off the internet, but it's coming from the Department of Health, it's coming from the CDC. So that's been helpful in those conversations as well.
Fantastic, Bethany. I was listening to you and I was thinking about the young lady who I think it's in Ohio. I can't recall what state it was that's doing the Vaccination, the incentive program that's coming from the state where they're giving $1 million for persons who are taking the vaccine and they've got a chance to win $1 million. And a young woman won it on yesterday. So she was on the news this morning. So I thought about that in terms of your conversations with your peer group and what incentives might it take to get our younger people vaccinated, because we're seeing, I believe the numbers are showing that that's the group that's lagging a bit. What might it take? And so maybe not a Vax-A-Million in Louisiana. I don't want to put Secretary Phillips on the record as saying we should do that. But what are some incentives, and from your opinion, that you think might work to encourage some of your peers to get the vaccine?
Well, I know that there are a few incentives in certain cities that are already taking place. I know that there's the shot for shot. Like I said, people like happy hour. So that's something that I know some of my friends and other person, we maybe we all like happy hour. I don't know. I'm sorry, first name in Montgomery. But yeah, I know that's an incentive that I've heard that's going on right now as well. I mean, I know that there are some voucher programs that are also taking place for persons that are getting the vaccine within a certain time period. So I mean, people like incentives at all ages. So I mean, hate that it takes an incentive for you to try to do something like, get a vaccine that's really supposed to be for your health and maybe your protection. But, we have to do what we have to do to try to spread the word and, get as many people as we can vaccinated. So at some point, we will be back to some form of normalcy. It will never be the same after COVID, but at least getting to a point where people are comfortable and that we can enjoy Jazz Fest, enjoy festival season again. Like I'm really looking forward to the days where we can have a good festival, good second line.
That's right. I can't wait for that turn up.
Yes.
Definitely, if we're still using that term, turn up. Can't wait for that one. Very good. We do have another question from one of our audience members, and it's this is directed to you, Dr. Taylor. What advice would you give to young women ages 20 through 35 that have not had children and are afraid to get the COVID vaccines because of, I guess it's because of rumors. Let me see, it dropped off. Oh, because it might affect their childbearing ability. Yes.
So we do not think at all that the vaccine will affect your childbearing ability. The science is not there. They are studying it. We don't see it. So it's so easy for me as a physician to say, don't be afraid. But I understand the angst. I do understand that, and I know, and I was going to actually say this at the end if I would have had a chance, but people are worried that, it's just so new, but it's not. It's not as new as you think. And remember, as far as the safety and efficacy, which I'm sure this is why this question is being asked, is no shortcuts taken when it came to doing these trials. It wasn't done any differently. They started producing the vaccine sooner, but the way that the trial was done was standard as in any other trial. So it's going to be fine. Get your vaccine, because we also know that if the vaccine is safer than you getting the virus, the infection. So we know what will happen to you if you get the vaccine. We know that. We've had 100,000 people in these trials, and we know that it's going to protect you from severe illness. You're not going to get admitted to the hospital, and you're not going to die. We don't know, however, what will happen to you if you get the infection. So some people will do fine. Some people may die. I don't want that to happen, but there is no way for us to know, because not only are older people dying, but there are younger people dying. So we know that if you get the vaccine, it's going to be safer. Yes, they have some side effects, and only about 30% of people get side effects, by the way, but it's going to be, those side effects are going to be gone within about a day or two. So childbearing, you're going to be fine.
Thank you. I think you've really helped to calm a lot of fears in that regard, especially as we have our many younger people listening to us this evening. So last question for all of our panelists, and it may sound a bit like deja vu, but we want to sort of recap it now that we've had this opportunity to have a full conversation ranging from the science to faith to mental health issues, and even our younger women. I will ask you again, just sort of a rapid fire round, if you will just respond in just a few words. What is it that you want the women on this webinar this evening to take away from our all-female conversation? And we'll start with you, Dr. Taylor.
So I sort of said it, but I want you to remember that you can have a huge impact on your family and your friends. Please remember why you're doing it. Even if you don't really want to do it for yourself, do it for your family, do it for your friends, because we still have asymptomatic COVID out there and we don't know if we have it. So it will be better if we're vaccinated, and we will protect way more people than we will ever imagine.
Okay. Linnell, parting words on the same question.
Yes, I would say protect your body, protect your mind, have hope. And I want to end with a quote from our former president, Barack Obama, who emphasizes that we all have a role to play to get to a better normal, and we have an opportunity to solve this thing.
Fantastic. Okay, Dr. Slaughter.
Be confident. Be confident that you are making the best decision for yourself and your family. You want to hug your grandmother. You want to see your friends. You want to travel. Be confident. Get the information, the correct information, and make the decision. I am waiting to see what happens. It's already going on. Study, make the right decision, vaccinate.
Vaccinate. Bethany.
Use your voice, spread the word.
Love it. Thank you. And last, Leah. I was holding you for last, maybe another little sermon there.
Well, again, I want to remind us all that we are all influencers, and I encourage all of us to continue to have these conversations, to share information, to talk about COVID-19, to ask our family, our friends, our colleagues, and all the persons that we have contact with, whether they have been vaccinated, why or why not, and have these discussions. Do not become comfortable or complacent. Do not let our guards down, because COVID-19 is not packed up and left. And lastly, I would say remain vigilant. Let's do our part. Get vaccinated.
Fantastic. And I'm going to just add to that. Just don't wait. Vaccinate. Get it done. Get it done. Ladies, I want to thank you so much for your participation on this panel this evening. Bethany, Leah, Linnell, Rosalind, and Yolanda, thank you so much for your insight and your passion on this subject, and your care and concern in sharing this information with our viewing participants this evening. I do want to just make a quick announcement on behalf of the La Capitale chapter of the Links Incorporated and the Baton Rouge chapter of the Links. We've got a major service project that's coming up on next Saturday, June the 5th, and we are encouraging, this is for women, Dressing Her from the Inside Out. It's a drive-by drop-off suit donation, and all of these business clothing, business attire, I should say, benefits the Southern University Career Clothes Closet here at Southern. So we would encourage you to bring us your gently used women's dress suits for interviews, plus size professional clothing, shoes, handbags, new and unopened makeup kits and hygiene products, jewelry, accessories, you name it, anything that you can think of that a woman may need in preparation for her professional life. And we're accepting these donations from 11 a.m. to 3 p.m. on June 5th at the Shiloh Missionary Baptist Church, and that's located at 185 Eddie Robinson Senior Drive. So we encourage you to participate in our joint service project that we have going on June 5th. Again, ladies, thank you for your participation. I am now turning it back over to Ms. Brown for closing comments.
Thank you, Dr. Merrick. This has been an awesome conversation. I want to thank each and every one of our panelists, Dr. Taylor, Dr. Slaughter, Ms. Young, Ms. Blackson, First Lady Montgomery, and of course, our esteemed moderator, Dr. Merrick, for sharing all of your knowledge and expertise on your responses and for being a part of this especially important panel discussion. As community gatekeepers and medical providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness, and you've possibly empowered others' readiness to further protect themselves, their families, and their communities from COVID-19. We thank you. As Dr. Merrick summed up, we definitely want you to walk away with some key takeaways. Information. Please make sure that you get up-to-date and accurate information from credible sources related to COVID-19, such as LDH's website. Vaccination. Knowing that each and every Louisiana resident over 12 years of age and older is eligible at this time to get vaccinated against COVID-19. And prevention. Despite the relaxation of restrictions, COVID has not gone anywhere. And so we still need to mask up if you feel it's appropriate, social distance, wash hands, and continue to protect yourselves and your families from COVID-19. Please find appropriate resources such as the Sleeves Up campaign that is through the Louisiana Department of Health and in the one-pager that you will receive as a registrant of this webinar. Most importantly, I want to thank all of the attendees for coming and listening to the discussion. And I hope that you found something enriching and valuable that you can take back and add to your discussions with your families and within your communities. Because at the end of the day, we are all in this together. Please utilize the resources that we have supplied inside of the chat box, the one-pager, which outlines the facts regarding COVID, how to share COVID information, where to get trustworthy COVID information, and resources that are available inside the state of Louisiana's website. Thank you. Lastly, I'd like to say thank you to the entire staff of the Office of Community Partnerships and Health Equity and all of our Louisiana Department of Health staff members. It takes a village and a community to and participate in these webinars, and we appreciate each and every one of you. Thank you all and have a great night. Lastly, I would like to give a huge thank you to the Office of Community Partnerships and Health Equity and each and every staff member of the entire Louisiana Department of Health, including our leader, Secretary Phillips, for all of the hard work in responding to this COVID pandemic. Thank you so much for the work that has continued to help our community because we're all in this together. I wish everyone on this call and everyone that hears this webinar replay a good night. Thank you for attending.